You know, and it dovetails into an important issue. We have lost so many celebrities this year.
Yeah, three so far.
Dying from heart issues. And so what we thought we would do is talk about this. We Carrie Fisher from a heart attack. We have George Michael from heart failure.
Yep.
How about Alan Thicke?
Ruptured aorta.
And so here to explain the difference is Dr. Chaffoo.
Good morning, doctor.
Good morning, guys.
Well, let's start with Carrie. She suffered an attack on the plane. She was not getting immediate care at the time. I mean, let's talk a little bit about her and what happened during that time.
Sure, Maria. So the issue, unfortunately, with Carrie Fisher, you know, she was in an aircraft, and apparently she'd been unresponsive for, I believe it was about 10 minutes before someone began CPR. You know, unfortunately, after about 5 minutes of being unresponsive and not receiving CPR, you begin to have irreversible brain damage. So that certainly was a catastrophic factor, but we know that unfortunately heart disease is the #1 killer for women throughout the world, and certainly symptoms can be anything mild from you know, chest pain. The pain can be atypical in a woman, can involve pain in the jawline, in the back, in the stomach region. You can feel like you've got the flu or you're just kind of weak. So symptoms can be anything from very classical, you know, anterior chest pain, to very non-specific symptoms, and oftentimes people, and especially women, because of course they're very busy, will just brush off those symptoms and will not go to see a physician. So oftentimes before someone has a catastrophic myocardial infarction or, you know, an end-stage heart attack, they've already had smaller heart attacks and smaller symptoms or smaller warning signs that they may have just brushed off. Now, the problems are that people that have a history of drug abuse, people that are overweight, people that are smokers, diabetics, all those people have a far greater risk for not only heart disease, but catastrophic or fatal heart disease.
What about the airplane factor? One of my best friend's dad passed away in his mid-50s, and he was on an airplane.
Yeah, Chris, that's a great point. You know, unfortunately, when we're on an airplane flight for 4 hours or longer, we double the risk of developing a blood clot in our legs. Now, the problem with that, it's called a DVT or deep venous thrombosis, is the clot that forms in the leg can travel up and actually lodge into the lungs. And if it's large enough, it can eliminate flow back to the heart, it can eliminate oxygen.
So what do you recommend then? I mean, if you're on a long flight, more than 4 hours,
move around, or what do you...
Exactly, Maria. So the big thing is all about mobility. You want to make sure that if you can get up and move around, you know, a lot of times people don't want to bother the person next to them because they're sleeping. But the worst thing you could do is fall asleep for a 6 or an 8 hour flight. You really double your risk of developing a DVT. So mobility is very important. Make sure that you're drinking a lot of fluids. You know, remember that when you're in an aircraft, and you know, it's pressurized, but you're still at about 8,000 feet above sea level, so you become very dehydrated. And the lower oxygen tension at 8,000 feet, you know, stimulates you to make more platelets, and platelets are the factors that clot the blood. So that combination of factors, we don't drink enough fluids, so again, our blood gets thicker, more viscous, more likely to clot. But the big factor, you're right, is mobility. Some physicians even recommend a long flight, maybe taking a baby aspirin, you know, a day or two beforehand.
That is good advice, actually. Yeah. On Christmas Day, Dr. Chaffoo, George Michael passed away from heart failure. How's this different from a heart attack? And we know now, we're hearing about heroin, and how does that actually affect you as well?
Right, Maria. So, you know, heart failure is kind of the end stage of the heart. The heart can take a number of insults until there's only a certain amount of heart muscle that's left to actually function. When it gets below a certain function, it becomes very ineffective. Fluid builds up in the lungs, we get pulmonary edema. And certainly, you know, heroin, unfortunately in the United States, about 600,000 Americans a year try heroin, about 300,000 of these yearly. And unfortunately, heroin is a highly addictive, in fact, it's the most addictive of all the narcotics. It's related to opium. And what happens with it, Maria, is it actually depresses the cardiac system and the respiratory system. So if even in a single dose, certainly can have a profound effect on you. You can actually stop breathing, your heart can stop beating. So it's a serious drug that has significant complications. Certainly if you have a history of heart disease where your heart function is already impaired, and you add on top of that an illicit drug, an opiate that depresses the cardiac system further, it's not hard to theorize that you can have cardiac arrest, and if you're in a home, and I understand that unfortunately George Michael was found in his residence, there's no help at that point.
Even at age 53 in this case. All right, Dr. Chaffoo, thank you for weighing in. We really appreciate it as we try to wrap our heads around losing
Dr. Chaffoo,
such iconic
wonderful.
stars
Yep.
from Hollywood.